A new Director General for the World Health Organization will be elected at the upcoming World Health Assembly, which begins on the 22nd of May.
Just 3 candidates are left in the running for the top place. To replace Margaret Chan, only one is from Asia, and that's Pakistani cardiologist Dr. Sania Nishtar.
Our correspondent Javed Rana speaks with her in Islamabad about the challenges facing the World Health Organization and why she thinks she's best placed to lead the organization.
What makes you the best candidates for the top position of WHO, and particularly against the British and Ethiopian candidates?
Let's start with my background, because my background is the most diverse. I combine deep experience in the civil society and combine it with public sector experience at all levels, including at the ministerial level. I'm a physician and combine it with a research background. I have deep experience in the multilateral system, co-chairing WHO commissions, serving as chair of UN panels, and I combine it with experience working with grassroots communities in the developing world and building institutions from scratch. And then, of course, I'd like to position WHO and to develop a paradigm change where WHO becomes more responsive to countries' needs rather than implementing top-down Geneva-based solutions.
WHO has been severely criticized over Ebola crisis in the past. What do you think was the primary reason? And in case, God forbid, something similar happens in future, in what manner WHO can possibly handle it?
In terms of the learnings from Ebola, there were several for WHO as an organization, and there were many learnings in relation to the country's response. So in terms of WHO, the communication between the countries, the governments, the country offices, the regional office and the headquarters could have been a lot better. And I think there's need for trust, some very clear signals, some accountabilities and responsibilities with regard to that. One of the key learnings from the crisis was that the humanitarian system ought to have been mobilized much earlier. And under the new health emergencies program that WHO has, member states have now agreed upon and the Secretariat is now implementing. Then, of course, at WHO, at several levels, there are issues of capacity in terms of funding, in terms of HR, in terms of programmatic capacity, in terms of investments in some of the critically needed areas. For instance, event-based global surveillance. In lay terms, this is how WHO gets to see where outbreaks are happening, is not well resourced at WHO, and there's need for injection of better resources there. For instance, at the field level, which is where WHO needs to mobilize its field teams in case there's an outbreak for an investigation, requires that WHO has some core capabilities at the ground level, and in many countries those are not there.
What are going to be possibly challenges for the WHO for the next 6 to 12 months once you land on your job?
We talked about the threat of a pandemic. It is real. It is an epidemiological certainty. It is not a question of if, it is a question of when. And WHO has to be prepared in relation to all these parameters we talked about now. The implementation of WHO's new health emergencies program is a priority, and it needs to be well resourced. Secondly, the threat of non-communicable diseases. These are diseases that do not spread from person to person. These are diseases such as high blood pressure, diabetes, heart disease, some cancers and chronic lung conditions. These have reached pandemic proportion already all over the world, and some of them are wiping out the development gains of the last century. And WHO needs to reposition itself to be able to respond to these challenges because they require a very different mindset, a very different set of competencies. And because I come from that world, I understand these quite well. Thirdly, there are some other transborder threats such as antibiotic resistance. That is already spiraling out of control and is actually threatening to throw us back to Stone Age as far as medical care is concerned.
Isn't it a very tough job, and you have opted for it, and this time around it's going to be elections? How challenging you really feel about this entire electoral process and the campaign you've been in?
Well, I have opted to throw my hat in because I think my whole life's experience has prepared me for this role, and I think I will be able to do a good job. I'd like to say this in great humility. In terms of the campaign, it has been a long campaign. I've been campaigning for almost a year and a half already. I've been supported by my government, and it is truly an honor and a privilege to be in this process. I've had the opportunity of meeting more than 190 countries bilaterally. I've traveled all over the world, and to present my vision for a new WHO, I've sought inputs from member states. And I have followed the code of conduct in the earnest. I have not made any deals with any country throughout this election. And I am really grateful to a number of different member states who, regardless of political considerations and political expediency, are supporting me because they recognize that I stand on a platform which has the promise of bringing change, a platform centered on integrity and the ability to turn around reform and embrace meaningful transparency and accountability. And I am very hopeful that I will indeed make it.
Our correspondent Javed Rana speaking with Dr. Sania Nishtar, Asia's candidate for the next Director General for the WHO.
So this is the 70th World opening. It's going to last about 9 days, one of the longest ever. And we will find out who's going to be the next Director General.
Wow. Okay.